Good morning. I'm Dr. Velasquez, Health Officer for Spokane County, and today I'm joined by two of our team members, Mackenzie Driscoll from our epidemiology team and Adam Swenson, who is one of our community workers on the far right, middle, and then me. Right, that's the way it goes. So we're here today to talk about hepatitis C. And I'm sure you're going, huh? Is there more than one type of hepatitis? And the answer is yes. Actually, there's like 5 common viral types of hepatitis, A, B, C, D, and E. Mm-hmm. But we also have other kinds that are non-viral. But today we're going to focus on just one of them because it's very important from a community perspective, and that is hepatitis C. So with that, I'm going to ask Mackenzie, so what makes hepatitis C different from the other ones and so important for this conversation?
So hepatitis C, like you said, is a type of viral hepatitis. And hepatitis refers to inflammation of the liver, which can be caused by lots of things like drinking too much alcohol or taking too much of a medication. You've probably heard of hepatitis A and B, which we vaccinate for in the U.S. And hepatitis C is similar, that it's also a viral hepatitis. It is the most common type of viral hepatitis in the U.S., and it is curable.
Okay, so that makes it different than the other ones.
Yes.
Okay. And how do people get hepatitis C? What may put you at risk, for example?
So hepatitis C is spread through blood. Most people know about it because of its association with injection drug use, but anyone can be at risk for hep C. And some other common ways people get it are through blood transfusions given prior to 1992, tattoos given outside a licensed shop, and occupational exposures. It is not commonly sexually transmitted.
Okay, and you mentioned 1992 for blood products because since then we've been testing not on, for a lot of diseases that can be transmitted through blood transfusions. So that's good to know. So how do you know that you have hepatitis C?
So one of the challenges with hepatitis C is that most people don't have any symptoms, and that's why it's so important to get tested. Mm-hmm. But if you do have it, it is curable with 8 to 12 weeks of medication.
Okay, so why would you go and get tested? What makes you think that you should?
So the CDC has a recommendation that all adults in the U.S. get tested at least once in their lifetime.
Got it. So if you're an adult, that means anybody over the age of 18, right? Mm-hmm. Get tested, and if you haven't, talk to your primary care provider. I'm sure that we'll be able to make those arrangements for you. So if I'm the average person, I go like, well, I do know that for all diseases, there are some things that will increase my risk for severe disease. Mm-hmm. And I know hepatitis is a continuum. Some people get very sick, some people don't. So what do I need to worry about in terms of potential higher risk for severe disease?
Yeah, so hepatitis C does become a chronic illness for most people who get it. And the people who are at high risk for severe disease are the people who never get tested and treated. Like I said, it is curable, and the people who never get tested and treated are also going to be the people who are at high risk for liver cirrhosis and liver cancer.
So one of the long-term effects, if it's not treated or diagnosed early, could be damage to your liver.
Yes.
Cirrhosis, as you mentioned, or even liver cancer, which is a very severe complication of any disease. Now, what are we seeing in Spokane County?
So Spokane has high rates of hepatitis C compared to the state average and to similar counties. The reason for that is complex. Okay. We've been hit particularly hard by the opioid crisis, and that is often associated with higher rates of hepatitis C.
I see. It's kind of interesting because, substance use, although it's not 100% correlation with a lot of other things, but there's a high concurrence. Yeah. Where you find it's a multifactorial issue. And I think hepatitis C is one of those things that we may not think about, but it may be related to that. Yeah. So I want to ask Adam a question. So as a community member, what can I do to be helpful? What can I do to help decrease the risk? What can I do if I think someone needs to get tested?
Yeah. So like Mackenzie said, there's a high rate of hepatitis C in Spokane County, and one of the best ways to find out if you have hepatitis C is to get screened. And the Spokane hepatitis C work group is made up of a bunch of local healthcare organizations and providers, and we're putting on a Hep C free Spokane Day event on Monday, July 28th, from 2 p.m. to 8 p.m. We'll be right in Riverfront Park, right in front of the pavilion. Local healthcare providers will be providing vaccines, linkage to care, and other medical services. There will be free Hep C screening, and then there will be a variety of local community organizations there providing other resources for the community.
Wonderful. So that's Monday, next Monday.
Yep, Monday, July 28th.
From what time to what time?
2 p.m. to 8 p.m.
Okay, so if you're working, you can go after work, right?
Yep.
If you leave work early or you work earlier in the day, you can
Yep.
go at 2.
Absolutely.
And our providers will be there. And you mentioned the Hepatitis C work group, which is something a lot of people may not know, but is actually a group that has convened, including members of our team, Mackenzie and others, to look at what can we do to decrease the prevalence of this disease in the community, and what can we do to provide access to testing and treatment if necessary. It's one of those groups that probably most people have never heard about,
Right.
but has been working in the background to increase access, increase awareness, and improve outcomes for the community. So I wanted to give them a shout out because it's not only the team here, but we have a lot of community partners that have come together to do that. And if you go on Monday, you will meet a lot of them because they're going to be there. I do know that there will be a lot of services that are available. And if for no other reason that to get some information, just go, come by for half an hour and you'll get lots of information,
Yeah.
meet some people, and hopefully that information will help you help others
Yeah.
as we go forward. Anything else you want to tell the people before we go today about hepatitis C?
It's common and it's curable.
That's right.
It's common and it's curable. So hepatitis C is common and it's curable. That's 3 C's.
Right. That's right.
Common. What was that again?
Common and curable.
Okay, so hepatitis C, that's a C. It's common and it's
And it's
curable.
curable.
That's right.
So we should use that in a poster or
I
something
think we
as
should.
we go forward.
That'd be a good idea.
But all kidding aside, folks, as we mentioned, it is a disease that can be tested for, can be treated. If left untreated and undiagnosed, it can cause severe disease. And the sad part of that is there are resources available. So if you're curious about it, if you're an adult and you haven't had hepatitis C testing, talk to your primary care provider. I'm sure they'll make it part of the next visit. And you can, very easy, you can get the testing and get the results. And if the results are negative, then we move on. If the results are positive, then there's intervention that can happen.
Yep.
So with that, I'm going to say thank you to both Mackenzie and Adam. And also going to take the opportunity to say thank you to our partners in the Hepatitis C work group. It's one of the many efforts in the community, kind of behind the scenes, trying to address issues that are of concern from a public health and a health perspective. So with that, thank you again. Thank you, both of you, for coming. We'll see many of you on Monday. And if we don't see you there, we'll see you back here again next Wednesday on the next Facebook Live. So stay well, take care, and we'll see you next Wednesday. Thank you.